My name is Claire and I am a clinical nurse specialist with Hammond Care in the community palliative care team at Greenwich. Deterioration is a sudden or gradual change in a person's condition. And when a patient is beginning to deteriorate, there may be subtle changes which are quite significant. For example, a person might love a coffee every morning and has had that for 50 years, and then one morning decide they don't feel like their usual coffee. This is quite a subtle but significant change. They may be less interested in what's going on around them, increase fatigue, be weak that they want to spend most of the day in bed sleeping, and they may eat less until they are eventually not eating or drinking anything at all. And eventually the person will take to bed and all their care will be in bed. A patient who I visited who was very particular in the way that she looked, was always beautifully dressed, full face of makeup, wig on. As things began to change for her, she would stop wearing her makeup, wouldn't wear her wig, and then one day I did visit her and she was in her pajamas, and this was a very subtle but a significant change. It's really important we pay attention to the signs of deterioration and recognise them for what they are, so that we can guide the dying person and their families and caregivers with what to expect as things continue to change. And in doing so, we can reduce their anxiety, as they will know what to expect and there won't be any surprises. And it gives the families and caregivers the choice to be present at the end if they wish. And it also gives the opportunity for the person themselves to know what's going on so that they can say things if they have things that they want to say. And it gives the clinical staff an opportunity to prepare things such as medications. When trying to determine where someone is in their illness, you should ask yourself the surprise question, which is, would you be surprised if the person you're caring for would be alive in 12 months? And if the answer is yes, then that helps to identify patients who may have unmet palliative care needs. It's more accurate in patients with cancer, as it's kind of easier to predict their trajectory. There are several tools to help identify when changes are occurring. There's the SPIC tool, which stands for Supportive and Palliative Care Indicator Tool, which helps identify people with deteriorating health due to advanced conditions or serious illness, and it prompts holistic assessment and future care planning. There is also the Hammond Care Palliative End-of-Life Flip Chart, which provides clear guidance for end-of-life symptom management, and each symptom is listed from depression, anxiety, shortness of breath, constipation, which can then be addressed by reviewing possible causes, questions to ask, what to do clinically, as well as non-medical treatments that can be provided. And this resource is used in many facilities as a go-to guide for staff. Non-medical trained carers can recognise deterioration. In fact, they would notice it the most. Carers in aged care facilities are often spending a lot of time with residents and therefore would be the ones to recognise these changes. At the same time, they may miss some subtle changes, like when you have children who you're seeing every day, you don't notice that they're getting taller, and then people who haven't seen them for a while would say how tall they've gone. And that's kind of those subtle changes they may miss. The main challenges to establishing deterioration is that the trajectory of illness can be very different. When you're comparing it to cancer or COPD, which is chronic obstructive pulmonary disease, versus dementia, there could be a few peaks and troughs, which are quite challenging, whereas patients may suddenly deteriorate and then stabilise again, and that's their new baseline, and then they may have another deterioration, which can make it hard to kind of plan for future planning. If you notice changes, you should inform the registered nurse and GP in the aged care facility, or if you're at home, speak to the patient's GP or the community nursing team if they're involved, or if they're linked into the palliative care team, let them know. Also, families and caregivers should be informed, as well as the patient themselves, that things might be changing, and ask the person if they've noticed these changes, because it's likely that they have. And if symptoms are complex, then refer to the community specialist palliative care team.